One of the things that makes this show different is that we invite you, our audience, to choose the stories we cover each night. We've received many requests about the Zika virus. People want to understand more about it, including Monica, who sends us a question from Tulsa, Oklahoma.
Here's my question for you. Throughout the years, we've heard of all of these scary viruses. The hantavirus, the norovirus, recently the Ebola virus, and now this Zika virus. Or is it Zika virus? First of all, how do you pronounce it? Where did it come from? And should we be worried about it?
Here to answer these questions is holistic doctor Robert Silverman from New York City. Thank you for joining us.
It's a pleasure to be here.
Would you please answer Monica's question, because I want to know the same thing.
A lot of people want to know it because yesterday, on Monday, the World Health Organization called it a public health emergency. Zika is the name of it. This is the fourth time since 2007 the World Health Organization has defined something as a public health emergency. It was the swine flu, it was the resurgence of polio, and it was Ebola.
So this thing is no joke.
This thing is no joke.
All right, is this thing coming up through my borders? Because it said, I'm looking right here in the BBC, it says this is linked to Latin America.
Yeah, it's in Latin America. Really, the bed of it is in Brazil. It's in 24 countries. So what we're finding out is it's carried by a mosquito. So the mosquito bites somebody that's infected with this virus. And then they go around and they bite another person, and that person now gets infected with it and is a carrier during that time period. Now, if it's just in adult humans, 80% of them don't even know the symptomology. Unfortunately, what's going on is...
What are the symptoms?
The symptoms are headache, fever, rash, and a little pink eye conjunctivitis. Lasts about 2 to 7 days.
Okay. All right. Obviously for the WHO to put something out, this is a dangerous thing, no?
It's a dangerous thing because it's to pregnant women, what they're finding out is the fetus is exposed. The placenta now goes to the amniotic fluid, and that amniotic fluid is connected to the child. The child is now being born with microcephaly. It's a small brain. It's like 2 to 3 standard deviations smaller than the normal head. So this smaller brain leads to neurological deficit, early death, and it's just not really a good thing for the child.
Okay. So what do we, look, some guy or gal's sitting here right now, they're watching this. And they're saying, all right, what do I do to protect myself against this?
Well, the CDC has a mosquito protocol. The protocol is very simple in that they say wear long sleeve shirts. Okay. In a mosquito area. Number 2, use a particular EPA, a type of sunscreen and repellent. In addition, what's surprising about it is the women mosquito carry it in the most common fashion. They come in from dawn to dusk. So what you want to do is have air conditioning and filters into your hotel room.
There was a thing here that said that it's translated through sex. There's a new, what is that? What is
a great way to go. But, there was an instance where somebody came back from one of the Latin American countries and had sex with his wife, and 3 or 4 days later, she was seen with the virus. So it was seen in labor, it's seen in some blood transfusions and the like.
Could one of the cures be to secure, I know you're a doctor and everything, should we just secure our borders and maybe we wouldn't have to worry about this, or are we still going to have a problem?
Well, they're airborne mosquitoes, so I don't know if we'll be able to do that. They're airborne. Interestingly enough, Toronto did a study and found out that, in brevity, that our climate can house those mosquitoes. So if I were everybody, it would be the air borders and everything.
Thank you, Doctor. When we come back, we continue our discussion about diseases that are coming through our southern border. Don't go away.